My name is Marc Succi. I'm a physician at Mass General Brigham and assistant professor at Harvard Medical School. So one challenge we've seen is that transition of students from the preclinical curriculum at the medical school. So that's generally the first year and a half, where it's primarily textbook study, into the hospital, where they're still students, but they're taking care of patients, and they have to develop these different types of problem-based learning skills to solve patient dilemmas. And so training students and giving them enough material to train on and also solving the patient problem is the particular challenge that we're confronting. And so what we did was we used ChatGPT and anonymized patient scenarios, so not real patient data. We're going to ask ChatGPT to help us as a student and physician pair together work up a 64-year-old man. Again, this is anonymized with a problem. And here you're going to see that we have a 64-year-old patient with fever, catching cold for 6 days, taking some antifebrile agents, stuff like Tylenol. Again, visiting the hospital, had fever again, dizziness and headache. What are your three differential diagnoses at this time? One of the key things you learn in medical school is creating possible or differential diagnoses off a limited amount of information. So if we had our own private GPT clinician mentor right here to help us through these cases, students can get through the cases faster, but also learn how and why these are differential diagnoses. Here you've given it, GPT's given us three different diagnoses. So we might then go further, right? A patient comes in, we have possible diagnoses, but I don't know what tests to order, right? My first time in the hospital, I'm on a new rotation. I went from medicine to surgery, back to medicine, let's say. What medical tests would we like to order? And then GPT is helping us figure out what medical tests to order, right? And so it's going to go through a whole list here. And then I can even do things like we can take, if we have a private instance of GPT, which means it's patient secure, we can actually provide it the tests we actually have from a particular patient all the way down to the x-rays. And so here, we're going to ask GPT to basically help us work through an x-ray of a patient, as well as some other information about a patient. And maybe I ask it a question saying, based on this information here, what is your diagnosis? And it'll help us work through it again. So, as a student, you definitely don't have a physician or a faculty with you at all times to help you work through these problems. Having generative AI as a basically tutor, which off the shelf is pretty darn good. We're working on some fine-tuned models now, is pretty invaluable and really is influencing medical education. What we learned, two things on GPT itself, on generative AI, in this instance, is that it's very good at making final diagnoses on patient scenarios. It's really not as good at doing differential diagnoses. So that's coming up with possibilities based on minimal data. And so I think about Harvard Medical School and how they train me and what they've really been world-class at. And it's really that differential diagnosis. It's that art of medicine. And so to know generative AI is good, but there are gaps, and those gaps are where medical schools and the university writ large can play an increasing role as experts, is important. So I imagine if you're using generative AI for something different, so outside of medicine, you want to characterize where it's good, where it's not. And you also want to characterize where your particular teaching can add value above and beyond generative AI as these products become, more commercially available.